Welcome to the Friendly Moms Club podcast with Jen and Karlee. We're the new mom friends you didn't know you needed.
We are creating a safe space to bring moms together, lighten the heaviness, and find joy in the everyday moments. Together, we will share our own experiences of being new moms while navigating the topics we wish more people talked about.
Join us every Monday to hear us skip the small talk and dive right into the uncomfortable.
Happy Mom Day, Karlee.
Happy Mom Day, Jen. It's a beautiful day because we have Jen back in the studio. And Jen is now a mom of two.
And I'm happy to be back.
Yeah.
Yes, it's crazy actually to hear that and to think about that. But
so why don't we just save our time talking about the silly things and you just get in and give us an update.
Well, so I had our second child on January 17th. Her name is Peyton. And she is healthy and doing well, and I am doing well and recovering nicely, and it's just been chaotic, and adjusting to having two children is crazy, and mad respect to all of you families out there that have several kids. Like, one kid was really difficult, and I don't know how people do this, but
I know.
It's been really fun.
Over and over again.
Getting
Bless
to
them.
I know.
And like
we're getting to watch the kids interact, and everyone says that. Like, everyone says the first time you see them together, but like I didn't believe them, and I didn't understand how I could love two children the same. Like, that was a foreign concept to me, but then all of a sudden the baby's here and it all just
makes sense.
It just happens. Yeah. Like, there's no way to explain it. It just,
I know, because you were worried about that. Yeah. You talked about that before.
I've been busy.
You're like, I don't understand how I'm going to do it. But I guess now you're like, I don't know how it's happening, but it's happening.
But that's what I mean. I don't know how to explain it because it just is. And it's
biology,
crazy.
Man.
This motherhood thing is wild, I tell you.
Yeah.
It's just wild.
Wildness. And thank goodness for daycare for little Miss JoJo. Because like, obviously when she's home, you don't let her watch TV because we're those moms. But I'm just kidding. Clearly I'm kidding. If you follow us on Instagram, you saw our newest troll.
I mean, everyone needs some TV babysitting. It helps. It helps you make dinner, helps clean the house, helps you when you have a newborn that you're trying to feed and your daughter wants to try to help by hitting them in the head. And like, it's good.
It is important. And also I feel like, especially kids who go to daycare or preschool, when they come home, it is a nice like wind down, and it's a nice like moment that they can have. And I don't know, maybe I'm just saying that to myself so that I don't feel guilty about using screen time, but hey, you do what you got to do.
It also is when Jordan will snuggle us the most.
Oh, yeah.
She doesn't sit still and snuggle us unless there's TV on. So it's a nice little bonding time.
It's good for everybody.
There's lots of positives I can think of.
It's good for everybody. Is there anything you want to share? So you told us about your new little addition. We're going to do an episode soon about how she came into this world, a little bit about the birth story, and then maybe we'll talk a little bit more about your feeding journey. But is there anything you want to just kind of throw in there today quickly?
I don't know. You're putting me on the spot.
Surprise!
I don't have anything in particular. Yeah. I'll go over her whole birth story, but we had a little bit of a snowstorm, and it was the day of the snowstorm, which if you don't live in the lower mainland, you would joke at the amount of snow that we consider a snowstorm.
Hey, that was actually a snowstorm.
But it was a lower mainland snowstorm.
That was a legit one, though.
I mean, people would still laugh if they were from other places that actually got snow.
Yeah. We don't know how to function.
So it's a memorable day. And it was on the 17th, and Jordan is born on the 17th of September, so we have a 17 thing going on, which is actually kind of fun. And I realized that our anniversary is on the 16th and Anad's birthday is on the 18th. So we're very 16, 17, 18.
Yeah, that's great.
Just a little fun numbers thing for you. Anyways, that's me in a nutshell. And I'm slowly turning my brain back on and getting focused back on podcast stuff. So I am just happy to be back at it with you.
Back to the real world. And if you want to know, kind of follow along a little bit more on Jen's journey and our journey in the podcast, make sure you're following us on Instagram at the Friendly Moms Club, because we share a lot about our day-to-day lives, and Jen's sharing a lot about newborn life. So if you're curious what 2 under 2 is like, or even just curious about newborns, or you just like us, then make sure you're following us.
Or you want to hear about a really hard breastfeeding journey, and you want to hear about all of the mental struggles that come with it. Like, honestly, we like to be vulnerable and share it all. So
I feel like the journey of breastfeeding, even just feeding in general, maybe even just having a child, is so much more mental than it is like physical. It's just, there's so many mental factors at play. And this is also a good thing that like mindset really does make a huge difference. And that is something that we have been focusing on lately, both of us, just having our own struggles and big life changes that we're really being aware of our mindset and how much that can change our experience. So here's our reminder. Say something friendly to yourself.
Huge. I actually can't wait to talk about this. Yeah. Because there's so much. I could go on forever about this. But.
Okay, I'm going to put you on the spot one more time here before we get into today's episode.
Okay.
What is, in the spirit of being friendly, what is one friendly thing you can say to yourself to postpartum Jen? Like early days, postpartum Jen, in the trenches, what is something friendly you can say to yourself? Like something you're doing well, something you admire, something you respect, something, maybe you brushed your teeth today, something friendly.
Yeah. Though that is a good day when I brush my teeth and I actually brush my hair, which I didn't do today. No, I am just proud that I keep showing up and that I'm doing my best. And my husband and I have this conversation because oftentimes I'll apologize to things like, I'm sorry I didn't do the dishes today. And he's like, well, you need to focus on the positives of what you did do today, not what you didn't do. Like, as long as you're getting up and doing your best every day, like that's what matters. And I have gotten up and gotten out of bed every day. And that has been a huge feat for me, just like actually getting up and I've kept going. And it's just been, I just keep showing up and that's it. It's something very simple, but I'm proud that I'm just still going and I'm doing my best every day. And that might not look like a lot every day, but it is a lot to me.
Of course. High five to postpartum Jen.
Yeah.
And even if you only have, say, 12% in the tank, if you give those 12%, then you're giving 100%. So that's just something to remember as well.
Exactly.
Because it's really easy in like the sleep deprivation state to then go down the shame spiral that you're not good enough. But you have to like remember the context in your capacity, and you do what you need to do to get through. And you also have a toddler. So that's where things like screen time and TV time come in. And we actually talk about that in today's episode. When you have sick kids or teething kids, that like you have to meet yourself where like you need your expectations to meet the context of what's going on in your life right now. So I also think you're doing a really good job at that, and I'm proud of you, and you're kicking butt.
Thank you.
And I'm excited for you to share a little bit more about your journey. So that will be coming out. Yeah.
That was a good segue into today's episode as well, because it's true. Like some days you just only have so much capacity, and especially when your children are sick and then maybe they've been sick for a while, you might not have a lot of capacity left in the tank. And so TV, you have to do what you have to do. And so today we're going to finish off some of the skin conditions and things that we experience with our little ones. And then we're going to go into our tips and tricks that we found when you have sick children and things that we found, helpful.
That you can do, for sure. Lots of good stuff in here because we've both been through it this first year. We both had babies that did not do well with teething and had lots of like weird sicknesses and random things. So we got lots of good tips to share. So let's just get into today's episode. This is part 2, a continuation of last week, illnesses in babies and toddlers. So here we go.
Yeah, enjoy.
So there's a couple funny things, not funny, but unusual looking things that can happen to babies, newborns specifically, that if you've never seen it before.
They're just kind of like a skin.
Yeah, and if you've never seen it before, it could be very like alarming and concerning, or if you have a newborn that comes out with one or develops something like this. So the few things we're going to talk about are hemangiomas and then baby acne and cradle cap, because those can all happen. And all of them seem very scary, but they're actually not. So,
and they're not normally like a long lasting thing either. Like they're all, especially baby acne and cradle cap, they like get resolved fairly quickly. Yeah. But all of a sudden, like things just start happening and you're like, what is happening to my baby? Like they had this nice perfect skin and then all of a sudden things are happening to it.
So let's talk baby skin first, because before baby acne, they can actually have something called newborn rash. So there's a long scientific name for it, but I actually don't know what it is. And this happens in the first few days typically. And the cause of this is that baby's been living in water. So their skin has been in amniotic fluid. And then all of a sudden they're not in the water anymore and they're outside, and their skin is learning how to exist in a new environment. So newborn rash looks very scary. It looks almost like like poison ivy or like an allergic reaction because it's bumpy and it looks really irritated, but it doesn't actually bother baby. And it can be quite diffuse all over their body. And it kind of just comes on out of nowhere. So it looks terrifying, but it's actually not concerning and it's not uncomfortable for the baby. But if you do have a newborn and you notice this, it's typically newborn rash and it does go away on its own. After that, babies can get baby acne and cradle cap. Henry had a little bit of baby acne, but he had very little. For Jeff and I both having the worst skin, Henry had the absolute best skin and it was kind of annoying.
Yeah.
And it's just that. It's acne that babies can get. Don't touch it. Don't pick it. Don't do that. But you can put a little breast milk on it if you have any.
Mm-hmm. I actually did find that helped. The breast milk on it.
Yeah. And then another one that Jordan had that Jen can talk about now is cradle cap.
Mm-hmm.
So
it's just like it looks weird because they get this like yellowy, crusty layer on their scalp, and it can be like a small area to like almost their entire head, and it flakes off, and it's just really not. It looks so gross.
It ain't cute,
and it's peeling off their head, and you're like. It looks like it's going to be some crazy infection that's like, I don't know. It just looks like it's something bad, but it's actually very normal. And it's just like a lot of their oils and stuff getting trapped and coming out. And it's not any illness. And it doesn't mean that you didn't like wash your kid. Like there's nothing you did wrong. It just is something that happens. It's a buildup of their sticky skin oils, scales, and like dead skin cells that are coming off. Just, creates this yellow crust that just
looks cute.
Looks super cute.
What helped for you? What worked?
So we did it, and I found this like on the internet. I did Dr. Google this, but I had read about it and seen it on Instagram before. Is you use some oil. So we got like a baby brand oil just to make sure it was safe. But you put oil on, I think it's an hour-ish before you're going to go put them in the bath, half an hour to an hour. And you just like layer it all along where the cradle cap is, wherever that may be for your baby. And then you put them in the bath after the half an hour to an hour. You let it kind of like really sink in. And then you wash their hair with soap. And it was like a Frida Mom little brush that has like a little very soft bristles that you can use to wash babies. So we had one of those. And so you would like lather that up and then just wash their scalp where you put all the oil. And after doing that a few times, it was completely gone. Like it just helps kind of get some of those dead skin cells off. And I think we literally only did it like 3 or 4 times and it was all better. And it never came back.
And I think the key is that the oil helps soften it and then the gentle brushing helps get it off.
Like the flakes then can actually...
Yeah. The concern is like if you pick or scratch at it, that you can actually cause a little wound that it can get infected. So don't be picking and scratching at it. Don't try to peel it off.
It's very gentle. You need to gently remove it. So
it's like a spa treatment for your baby.
Just your little treatment for you, little child.
Little scalp treatment. Yeah. Little baby spa.
Yeah, she had that and baby acne at the same time. And it just like looks like all of a sudden your kid is getting all of these weird things on their skin. But now I know how normal it is. Still, like it's just
definitely very normal.
You don't want anything on their skin. Anything that comes up, you will have a mini freak out about.
Yeah.
Unless you're like the coolest, calmest parent out there. But I think 99% of us will
not.
be like, what is happening? What is this on their skin? What is this on their head?
Do you have any pictures of it? We could put it on our Instagram, but...
I'll have to look. This next one I do, and I actually think we should post it because this next one is another skin condition called a hemangioma. And it is basically a type of birthmark, but I never knew that this existed. I never knew anyone with one. I think everyone knows like you can get birthmarks. I think that's about as far as people's knowledge goes. Some people have them, some people don't. Fairly common. No one really goes into more depth than that. You can get something called a hemangioma, and it's actually very common as well. Now I know. In our mom friend group, I can count 7 babies that all had hemangiomas.
Yeah, it was a shocking amount. It was
a huge amount for our I don't know, 10 to 14 like moms that we saw regularly. But basically it's a birthmark that might not even be visible at birth. Sometimes they are very faintly and sometimes they are not. So they're a clump of immature blood vessels, but because of where they are, they're so close to the skin, you can actually see all the redness of the blood vessels. So for Jordan, she wasn't born with it. So she had no marks when she was born. Within that first week of her being born, all of a sudden we're like, what's on her shoulder? Like, that's weird. It was just a little red dot. And then a little bit more red dot. And then it was a little bit bigger. And then it got a little darker. And then it got a little bumpier. And hers went to, I'm trying to think, like 3 centimeters by 4 centimeters-ish. So hers was considered quite large for its size, and it was on her shoulder. So
and it was raised too, right? Like
hers raised and got bumps on it, which doesn't happen for all of them, but it can. And these can happen anywhere. Someone has it on their high on their forehead that we know, on their arm, on their back. Another one had it in the exact
hand.
same spot. Yeah, the hand. Another one had it in the exact same spot as Jordan, which was kind of funny. And similar size, like everything is Jordan's. But this was like every day it looked worse. And I was like, she has some sort of an infection or fungal infection that's like it's really red. It gets very bumpy. Because of where hers was, it would rub on things, or like car seat. When you put them in the car seat, it would rub on it. So hers actually bled, which led us having to go back to the doctor because bleeding isn't a great sign for them. And there is an actual like hemangioma clinic at our BC Children's Hospital. It can be serious, but it's only serious if it's developed somewhere like their nose or their eye or their mouth where it could affect their breathing or eyesight.
And feeding.
So that's really the only times they do anything about it. So there is a clinic, but it's really only for if it develops on one of those places.
Got it. So I imagine if you did have one that got too big elsewhere and was bleeding or something was in that way, or if it, like you said, their eyes, nose, or mouth. So if it's like breathing, eating, not sleeping, breathing, eating, or seeing, and then if it's big enough that something else is happening.
Yes. So we ended up going to the clinic for Jordan's because of her size and it was bleeding. So our doctor's like, just like, let's be cautious. She hadn't seen one that was this size before. So we went and the doctor said because of it, he would have given us medication, but it stops growing. So normally by 6 months, it gets as big as it's going to get. So it normally stops growing by 6 months. And for some people, it completely disappears by 18 months. And then most others disappear by the time they're 9. So it is just this the weird thing that like has a quick little burn and comes up and comes hot and heavy and gets big by 6 months. And then it'll just disappear.
Just go away. Does she still have it now? Or
she does still have it now. It's very faint. So hers is still the same size, but the color's almost completely gone. It's a very, very light pink. And some of the middle part is gone. So it kind of is like
a donut.
It's interesting.
Now.
I'll try to get a few photos so you can see the progression. I know so many people that have had one now. I'm like, just a hemangioma. Like, I know what this thing is. Again, when you see something on their skin, it's just
looks scary. Yeah. Definitely another one of those things that looks more scary and complicated than it actually is.
You think it's some sort of infection that's growing.
What's the name for it? Isn't there a strawberry rash or something, or a strawberry?
I think people call it a strawberry birthmark, but I think technically a strawberry birthmark is something different.
Oh.
Because then there's stork's bite that they can also get.
Yeah, Henry actually had those.
And that's very common. Another type of birthmark they can get, which is I think people talk about it, right? They know more about that one. Whereas hemangioma is just like,
and they look
caught me from nowhere. I had no idea what it was.
Henry had a stork bite, and then there's which is very common in like little Caucasian, like fair-skinned babies to have stork bites, especially it's genetic. So like all of his cousins have had them around their eyes and between his forehead, which that one went away, but the one on the back of his neck is still there. And interesting enough, my husband and all of his brothers have ones on the back of their necks that didn't go away, but the face ones did go away. You can only see it a little bit between his eyes when he gets cold. So another one that babies can get if they have darker skin, so common in like Southeast Asian babies, is congenital dermal melanocytosis. And that's just dark blue or gray spots that commonly appear like on their bottom and their legs, and they can look like big bruises, but they're another type of birthmark that babies can get that do go away. Those ones are present at birth. I don't know if they get worse or not. I just know I've seen a lot of babies with them. Yeah, so there's lots.
There's so many things, so many different skin conditions, and then also just like illnesses and infections that they can get that are actually fairly common, and a lot of people experience them. But we are here to empathize with you that it is scary. And no matter what anyone says, like we can normalize it till the cows come home, but like it's still going to be scary for you. You're still going to be like, do I need to go to the hospital right now? And every time we've gone to the hospital, a doctor has always said, trust your gut. Like if you think that you need to come in, bring your baby in. No one is ever going to be mad if you are concerned about your baby's health. And we've been told this by so many ER doctors that you believe it, right? Like it's normally you feel bad for going to the ER, like you're wasting their time unless you're dying, right? Every ER doctor we've had has been so nice. And it's just reassured me. They're always just like, trust your gut. Like if you think you need to come in. Like, yes, there's nothing we can do to help your baby today. And it was good. We checked her out. You know, we checked her airways. We did an x-ray. We know this. Now you can go home and rest easy. It's going to help your anxiety.
It's worth it for the peace of mind.
Yes.
And no baby had ever been seriously injured by taking them to the hospital when nothing was needed. But babies have been injured or hurt by not going in when there had been signs. So trust your gut. If you go in and they make you feel silly, tell them to kick rocks.
Yeah, that's a bad doctor and hospital staff.
In labor and delivery, when people come in for like kind of benign seeming concerns, or if their baby's not moving, we are so grateful and happy that they came in. Like, we do not care. We want them to, instead of sitting at home and being stressed, or the alternative, something bad happening. So it's the same principle. If you're worried enough to even consider going, just go. And like, look at other options. Maybe go to your doctor's office if you can, and urgent care. But if you have to go to the hospital,
clinics,
just go. And our healthcare system, at least here where we live in Canada, there's so many challenges into getting like appropriately timed treatment. And we rely on our emergency rooms for things that aren't emergencies because we don't have other options. So it's very frustrating.
Yes.
You do it. Go in, get the care.
And this kind of jumps us into the things that we found helpful. And one of them is that here in BC, we have a number called 811. So 911 is what you'd call in an emergency. 811 gets you in contact with a nurse, the easiest way to explain it. But you can call 811. You can be connected to a registered nurse, and you can go through their symptoms. And they'll go through some checklists and ask you questions. They'll ask you probably to take your baby's temperature, depending on what you're saying is the concern. Or we did it with a fall Jordan had, because those happen, right? And we called, and then they go through some symptoms. Is she vomiting? Does she have a mark? Is she bleeding? And they'll help you determine if it's worth getting medical attention. And sometimes they'll say, go to the ER. Sometimes they'll say, hang up, call 911. Or they'll say, you should call your doctor and try to get her in within a few days. Or you should go to urgent care, and they'll tell you where the nearest one is. And it is such a good resource that we have here. So especially if you're home alone and kind of going into that like spiral and not knowing what to do, they're normally very good and calming and reassuring, and will kind of help you be like, based on what you're telling me, like they can't obviously see your child, so they can only go off of what you're telling them. This is an appropriate, course of action. So it's a very good thing. If you don't have that, or if you don't know if you have that where you live, I would recommend looking it up and seeing if there's any type of nurse hotline that is available to you, because it's a very good like first step to take.
One of the recommendations, it's like either stay home, seek medical treatment, and like what level of medical treatment. And if they are telling you to stay home, they actually give you some recommendations on what you can do.
Yes.
So what symptoms to look for, when you should go to the hospital, what treatments, at-home treatments you can do. And I found when Henry had like a little tummy bug at one point and he was throwing up, and we called 811 because he was only like maybe like 6 months. We're like, I don't know, is this a concern? So we called, and they told us like exactly, they said, stay home, these are the things to watch for, this is when you should seek medical treatment, and this is what you can do at home to keep him comfortable. And I was like, I know I'm a nurse and I know these things, but when it's your own child, you don't know those things.
Nope.
So even if it's your fourth kid and you're like, I've been through this so many times before, why don't I remember? Like, it's normal to just kind of, it's different when it's your own kid. So it's nice when somebody literally tells you, based on what you're telling me, this is what you can do. Everything's going to be okay. It's the reassurance you need.
I had to also call them because I accidentally, not overdosed, but I gave too much Tylenol.
Yeah.
I bought Tylenol in the States, which is a different concentration than infant Tylenol in Canada. So there's different amounts you have to give. I got a little bit confused which one I was giving and which syringe I was using. Anyways, long story short, I ended up calling them, and they said, based on what you're telling me, like, there is no concern. However, would you like us? We can patch you through to poison control, and you can just double check with them. Like, what we're seeing based on the numbers, and they did the math for me, you're good. So they just patched me through. Someone answered right away. It was like, oh yeah, no, you're good. Like, what they tell you on those boxes is a lot lower than what they actually could consume and would overdose on. So there was no concern in my situation, but they were just so good and knowledgeable. And I didn't think about poison control. I just was like, too much Tylenol. Like, that didn't even cross my mind.
I don't know if I've even told you this, but we actually had to call poison control the other day. So I'm glad you brought it up. This is a good adding that to your list of things.
That's a thing, right? Yeah.
Yeah. We were at my parents' house, and Henry got into the mouse poison. Parents of the year.
No.
Jeff thought that he was playing with dog food because my aunt was there with her dog. And then like 10 minutes later, my mom was like, no, that's mouse poison. I was actually having a nap. So Jeff came up like literally having an absolute meltdown.
Like the worst way to wake up from a nap.
Exactly. I had just worked a night shift, and then he came up and was panicking. So I was like half asleep, and I was like, call poison control. Cause like, we don't even think he actually ate any of it. He was just playing with it. So we like washed his hands. I'm like, call poison control. They're very knowledgeable. I know they can be very helpful. From when my friend told me her kid drank nail polish remover and she called, and they were very helpful.
They were very nice.
So yeah, it was a cellulose based one. It was actually, he would have had to have like a significant amount to cause any issue. So yeah,
I wouldn't have thought of that. Yeah. So I'm glad that we both have these experiences.
Definitely.
So normalize it for all you moms and dads listening. If you've had to call or they accidentally got into something, it happens.
Yeah.
But no poison control. Know who to call in those instances, for sure.
And the poison control can be, like Jen said, for medications. If you think you've given too much, if they got into your medication, if they got into any type of like cleaning solution, like the list, there's lots of things. So it's not just like what we consider like a poison. It's anything that can cause poisoning, like a medication as well.
Even nowadays, there's been a lot more increase in like medicinal marijuana and things like that kids have gotten into. So things that, you know, are in normal quantities for you are fine in a child. Everything is different in a child. And I guess that's the most important thing. And that comes to this, one of the next points is getting a good thermometer that's actually for infants and children, because there's different ways to take your temperature, and how we as adults would take our temperature is different. Like it's not as great. It's not as accurate to take just the forehead temperature for a child. So getting a good thermometer to have at home, because that's one of the first symptoms you really want to know. Do they have a fever? And they're going to ask you at the hospital if they had a fever. They're going to ask you at 811. Like, it's an important thing to know, especially, as we said again, the less than 3 months old. So get one and know what a fever is. Know what the actual temperatures of a fever are for the different ages.
And the thing with fevers as well is you want to be knowing the temperature after you're giving medications. So if they have a fever of, say, 103, but you haven't given any medications, you need to give medications, wait the amount of time that it takes for it to work, and then take the temperature. Because the big thing with fevers can it be controlled with medication? If it can't be controlled with medication, then it's concerning. If it can be, then that's normal for a fever, right? So our next thing here is actually giving things like acetaminophen and ibuprofen, and using the correct dose and the correct amount, and actually making sure you're giving enough. So acetaminophen, like Tylenol, and ibuprofen, Motrin, Advil, those are the common brand names. They're actually different medications. So you can give both of them at the same time. So whatever the box says that you can give. So there's like a time frame and then a number of doses per day that you can give. But like Jen said, the amount on the box is actually less than what they can actually have safely. So you can give that maximum on the box. Yes. My husband was like really freaked out to give the Tylenol. I think you can give that one 6 times a day, every 4 to 6 hours. And he was worried that if we did the max that was on the box, that it would be harmful. And I was like, no, like this is the amount that they're saying is safe. Let's give the max. And you can give both of them either at the same time, or you can stagger them.
Yeah.
See what works best for your baby.
Know the times. That's the hard thing. And like Karlee said, like they would always write it on their whiteboard on their fridge, right? Like when you gave it, because sometimes my husband
wrote it in our notes app. Our notes app on our phone.
And sometimes, I think I read somewhere that they had just like a whiteboard on their fridge. So if they had to give their kid any medicine, they would write it on there and the time, so that if the dad went, or if you went out, or like, then you know. And it's just really important to know when you're giving it and how much and which one, and having those at home ready to go.
For sure. Yes. Making sure you have them. And then also with writing them down is, when you write them down, you can also calculate when the next dose is. So you can actually anticipate when you should be giving the next dose. Because if your kid is really sick with a high fever, you don't want to wait. It's like when you're in pain, you don't wait for the pain to get worse again. You want to be proactive and prevent it from worsening again. So if your kid is teething really badly, or they do have some sort of infection, you want to map out, this is the nurse in me, you want to make like a little administration record. You want to map out when you're going to be giving them, and then you can time it so they have it fresh doses before bedtime. So they have fresh doses before you leave the house, and kind of plan out your day. We would always do that. Like,
before bed is important.
Yes.
So that they can actually get some sleep and go to sleep.
For sure. We'd be like, hey, this one's every 6 to 8 hours. So if we give it now, then we can give it before bedtime. And if you miss that window, then it can be a little bit difficult, and you're waking them up sometimes, or they're waking up. Yeah. So kind of map out your plan, find a way to communicate with anyone else who would be giving the medication. And you can give the maximum dose that's on the box. And you can also give ibuprofen and acetaminophen at the same time.
Yes.
Nurse tips.
Yeah. Some
And
other kind of
don't wait. Yeah, sorry.
Yeah.
Yeah.
No, don't wait. You want to use it. It's helpful, and it's going to make your child much more comfortable. So a couple other like natural things I guess you could do at home is humidifiers in their bedrooms while they're sleeping, when they have those respiratory illnesses going on, the cold. A humidifier is really good. And on the same wavelength is you can put like your shower to really, really hot and like close the shower curtain or whatever. And then we've been told to just like bring toys, just anything, and bring them in the bathroom, and they can play with toys and just sit in there for a while and let the really hot moisture from the shower like sink in so they're breathing it in, and that can help with the congestion and the breathing. And on this whole note of like humidifier breathing, you also want them to stay hydrated. So just making sure that they get lots of fluids while you're doing this. Like you don't want to do all these things and not make sure they're drinking water and formula, etc.
Because that's definitely like the biggest concern with almost every infection is dehydration, whether it's like a respiratory infection or if it's something like a tummy bug where they're peeing or they're pooping and throwing up. The like most common complication is dehydration in babies. So whatever they're struggling with, find ways to get them hydrated, whether it's frozen popsicles of like Pedialyte, frozen breast milk or formula popsicles, and like maybe even things you wouldn't normally give, like actual popsicles if your kid is old enough. Like sometimes it is more important just to hydrate them than
after a certain age. They say like start giving apple juice, like things just that have some more calories and some more substance to them.
And then for us, the main thing is like we went back to the newborn tricks. We brought out the carrier, more bottles, the soother, contact naps, co-sleeping. Like we literally, when your kid is sick, it's like you have a newborn again. And you have to then go back to those like original soothing techniques. Like what works. We sang so much. Lots of that. Oh, and
played a lot of music.
Thing I was gonna say, lots of TV time. We needed a distraction. We couldn't just like let him sit there and be miserable, and like he needed something to distract him. And sometimes he didn't feel like playing. So something that really helped for us was just having something gentle, like Miss Rachel or Doggyland, or even like just we put on like Christmas music videos when it was the holidays, just something on the TV to help. Because
there's just no judgment here. No judgment. If you need this to get through the sickness and the illness, infection, whatever's going on when they're not feeling well, you do. No judgment from us. And you might feel guilty some days. Yes, this is something that you got to talk to your mom friends about, because really this is normal and we're all doing it. We are all doing it. Like we really are. Whatever
and like
is
ask
going to
them
work.
What their tips are. Yeah. See what works for them, especially if they have older kids. And there's often things that you would never think of, like Pedialyte popsicles. Like a lot of people have never heard of that. And then they hear it from a mom friend. And it's also just nice to know that like other people have been through it. So when Jen's daughter Jordan got hand, foot, mouth, she posted about it on our Instagram. And so many of you guys wrote in and like really helped reassure her that like, yes, it looks really scary, it's uncomfortable, we've had it, we're either going through it. And I think
it made a difference. It made me feel a lot better about it, and just to know a bit more about what's come. People sent pictures and like how it progressed, how long, like I just felt a lot better about it here, getting all these messages. So it was very appreciated.
For sure. And then on that note as well, if you're in the trenches, you're back in the newborn days, you have sick kids, teething kids, definitely, one, don't feel guilt and shame over whatever you have to do. And two, ask for and accept help when people offer it. It is so hard for moms to accept help because society tells us that then we're weak and bad moms if we can't do it all on our own, which is absolute BS. So ask for and accept help. Just do it.
I mean, for you, like your husband stayed home from work a few days because Henry wasn't sleeping at night. And if you don't sleep and you have him all day while he's at work, like it's just, you will definitely, like it's not good for you. So you guys would trade off with the co-sleeping at night and then being with him so you could sleep during the day. And like, so if you have to be like, no, you got to stay home from work, or hopefully they offer, it would be ideal. But like if you have to ask and be like, no, you got to stay home from, like I can't keep going on this zero sleep and this, like ask for help. Hopefully your parents, or you know, if you have family or close friends, whoever your little village is, like You might need
For
some
sure.
help when you're in the trenches of them being sick. It is very, very hard.
It's like the newborn days all over again.
It
And
really
if you have
is. It's a good point.
Yeah. If you have a mom friend who's like really going through it, we've said this before, but like instead of just saying like, let me know what I can do, give them a couple options. Say like, I can drop off groceries, I can drop off meds, I can drop off a meal, like give some options. And then that way they don't have to think of something, because maybe they don't even realize, oh crap, I'm almost out of baby meds, or actually you're right, we don't have any food in the house, or it's like when you actually offer specific things, it's a lot easier to say yes to them when you are the person being offered to.
Okay, like I can do X, Y, and Z. Which one is best for you right now? Like what would be the most help? And we've said this before, but Karlee did it to me the other day, so we'll talk about it again, is that like sometimes you just need to vent. And so Karlee's like, what mode do you want me in? Like, do you just want me to listen? Do you want me to give advice and have a game plan? Like what kind of mode do you need? Like, do you need actual help? Do you just need to vent and have a safe place to do that? Do you need me to determine the next steps, right? Like, I was ready to Google for you. But you can ask them, like, what do you need from me? Like, well, how can I actually support you? What do you need right now? Like, do you need me to look for open clinics and open urgent cares and phone pharmacies for you because you can't find the medication? Like, do you need me to go get you Tylenol and bring it? Or are you just venting because life is hard? Like, see what they need and be there.
You just want your feelings heard and you just want people to listen, and then they go into like fixer mode, which can also be helpful when that's what you need. But when you don't need that, you're like, shut up.
It's just, it's good to know what they actually need. Anyways, we could talk about this so much because it's such a...
We could.
There's so much
Clearly we've been through it.
And we have been through a lot. And everyone warned me, your kid is going to get sick a lot. Oh, you'll have a kid. They'll start daycare. They'll be sick a lot. I was warned, I don't know how many times, yet I never believed it. I never truly let that sink in. And now that I've experienced it, I was like, wow, they are right. Like, this is hard and this is a lot. And it's a hard part of motherhood that I don't think gets talked about enough. And it can really affect your mental toll and your mental health, especially if it's in those first few months that they're getting sick and you might already have postpartum anxiety, depression, stuff like that going on. And then they start getting sick. Like, it's been very hard for me. And I have been going through depression and anxiety in my pregnancy and dealing with my PTSD. And so my mental health's been especially bad right now. And dealing with Jordan being sick, she's had some weird symptoms. And I'm like, this isn't the normal cold stuff. And like, then they're telling me, oh, her hand, foot, and mouth isn't normal. And they're throwing out words like meningitis. And then I'm Googling and it's been really, really hard. So we just really wanted to talk about all of these things that are good to help, and just to help reassure you that like it's scary and it's okay to be scared. It's okay to, be overwhelmed. Ask people for help, accept help. Like, this is happening to all of us. We are all in these trenches. I don't know. Every mom we know right now has had a sick baby in the last 2 weeks. Pink eye, pneumonia, colds, RSV. What else? Hand, foot, and mouth. A couple have had hand, foot, and mouth. Like, there's just been so much going on. So many viral infections too. Ear infections, you name it. A few have been in like BC Children's Hospital for a little while. Like, a few have been like really needing medical help. Hopefully this was helpful and you learned something, or it made you feel a little bit like, okay, I got this, or I know what to do if I'm feeling overwhelmed, or what to look for. And don't just Google everything, because it'll
find
lead
a
you.
reliable source in your area. So the CDC is really lovely. For us, we have the BC CDC, and we also have HealthLink BC. Find something that is reputable. Some people don't like the government, but some sort of government agency to get your information, and use that instead of Dr. Google. Yes.
Talk to your friends. Find out if you have like a nurse hotline, who to call, poison control if you need it. Like, what resources do you have in your area, and just have that on hand so that you are prepared if anything happens. We'll link the sites that we did use for some of those definitions there in case you want to look it up more. And that'll be in the episode description. But thank you for joining us today. And we hope you have a happy Mom Day, and we wish you all good health for you and your children.
No sickness in 2024.
Yes.
Which... less sickness in 2024. Mild sickness in 2024.
There we go.
All right. All right. Well, happy Mom Day.
Happy Mom Day.
See you guys next week. Bye now.
Bye.